Thank you for joining us on CBSN Denver. We know so many of you have questions about the coronavirus, especially as the state slowly begins to reopen. That's why this week we're starting a new segment here on CBSN Denver. We're getting your coronavirus questions answered by a doctor. Joining me now is CBS 4 medical editor Dr. Dave Hnida. And Dr. Dave, the governor is calling this next phase safer at home, and a big part of that new order includes the use of masks. How will wearing a mask help us more businesses start to reopen?
Well, masks are important, but they're just one part of several steps that need to take place in order to get things moving a little bit faster in Colorado. I think the biggest thing for folks to remember is that wearing a mask when you are out and about is really something that is intended to protect others, not necessarily to protect you. Masks don't generally do a very good job when you talk about or think about them shielding virus particles from going through a cloth mask. On the other hand, it does a reasonable job of protecting others from any respiratory droplets that may be coming from your mouth. So if you're out and about and you're wearing a mask, really the reason you are doing that is to protect others. And really what you like to see is you like to see everyone wearing a mask, because if that's the situation, it'll be a matter of people actually looking out for each other. And that really is kind of the key in order for any of this to work, is that we need to take a look at how we are going to treat others in the community and how we are going to respond to trying to increase what we are able to do when we are out and about. So the sight of someone wearing a mask when I'm out and about and I'm wearing a mask is a great thing. Once again, that mask that I'm wearing is not to protect me from you. It is to protect you from me. Now, having said that, a mask is only one part of the big picture. Social distancing still is usually important, as well as limiting the number of people who are gathered in a closed space. And then you really need to take a look at, the role of hand sanitizer and hand washing. It still remains huge, no matter what you can, say about just wearing a mask. I think that one of the nicest things, though, about wearing a mask is that it will do one thing, and that one thing is keep you from perhaps touching your face more often than you otherwise would. So it's a good thing. You need to wear one. I need to wear one. We all need to wear them to show that we are really doing this as a community, as a state, in order to protect each other.
Absolutely. And so many people have questions about how long coronavirus actually lasts on surfaces. Can it stick to your clothes after a trip to the grocery store? Let's say you go on a walk. That's one of the biggest questions we're also hearing.
The folks who really we are most concerned about are those of us who are actually taking care of coronavirus patients, whether it be in a medical setting or whether we have someone within the household. We've got to watch out in terms of what we do with our clothing. But let's look at when people are out and about. They're going for a walk. They're going to the grocery store. The good news is that the virus itself does not really do very well sticking to fabric. In other words, it doesn't live on fabric for very long, if in fact it does land on your clothing. We think that surfaces, hard surfaces, maybe the life of a virus is about 3 to 5 days. When you take a look at cardboard, we think it's 1 day. When you take a look at clothing, we think maybe a few hours at most. One really important thing when it comes to viruses and clothing is the fact that airflow is really important. You're saying, what do you mean airflow here? That means keeping moving. Let's say you're out for a walk or you are in the grocery store and you are moving. Imagine a wind tunnel where you have airflow just coming at an object or even at yourself. What happens is viral particles will come at you, but then when they come near you, they actually wind up spreading apart and going past you. That's just the way something like an air tunnel works. The same theory actually takes place in real life when you are out and about.
And we're hearing a lot about antibody tests right now. In fact, National Jewish just started offering them to the public. And if you've had the virus, do you become immune to it?
It's interesting because it's important for folks to remember something about this particular test. It is not a test to diagnose coronavirus. Coronavirus, we need to do the swabs and so forth to see if you're actively infected. The other one, the antibody test, is a blood test to see if you have been exposed in any way. And if you have been exposed and have picked up the virus and therefore developed an antibody response to it. In other words, your body says, well, I've seen this virus, I'm going to produce antibodies to protect myself in the future. The problem with this is that we just don't know what that means. In other words, you may show that you were at some point infected with the virus. You may have had no symptoms, you may have very few symptoms, but we don't know what that means. Does that give you immunity in the future? We don't know. Does that mean that it's okay for you to return to work? We don't know. The other thing to keep in mind is the accuracy of these tests. Now, National Jewish and some other centers around the country are great places. The research they're doing on this, unfortunately, is very limited, but it's quality research. You can't say the same thing for the rest of what's going on in the country. There are more than 115 manufacturers right now who are making these tests and specifically marketing them to, well, we're going to tell you if it's okay for you to return to work. The problem is there's not a lot of FDA oversight over this. They're self-reporting their results. And so we do get concerned that the accuracy of those tests may not be as good as something that you would get from, say, National Jewish. So 2 parts to that question. Number one, does it in fact prove that you are immune and can safely go out into the world again and not worry about getting infected again or infecting others? And then the other part is just really how accurate are the tests.
And our last question here, COVID-19 seems to be affecting people differently. In fact, the CDC just added 6 new symptoms for COVID-19, like chills and sore throat. If you do get the virus, how long can people expect to be sick?
Well, it depends on how sick you become from it. There are obviously people who have no symptoms whatsoever and they don't know they've got it. They don't really feel badly for any period of time. People with mild illnesses, maybe several days, and that's about it. But then as you start to move into people who get more lung involvement, for example, they can wind up being ill for quite some time. Now, these are not even people who are necessarily in the hospital. We see people who are extremely fatigued, extremely short of breath, still having problems with feeling like they are getting enough air and just so tired they can't walk from one end of the room to the other. And this is 4 weeks after they were initially diagnosed. And that's because the virus just takes such a toll on the body and takes such a toll on the immune system that we often say that, well, hopefully you're going to wind up recovering quickly, but we just can't give you a hard number. What's even more unfortunate about it is some people tend to go wax and wane in terms of how they do recover. They'll have a week where they just feel miserable, and then all of a sudden it's like, I'm feeling a lot better. And then all of a sudden they're running a fever on day number 14. And it's very discouraging. They begin to get better, and then they begin to have symptoms again 3 or 4 weeks down the line. And then contrast that to people who are hospitalized and require more extensive treatment. We think those people are actually going to be down for quite some time, up to 2 to 3 months before they get full recovery. The virus takes a heck of a toll on your system, not just on your lungs, but on your immune system in general and many other organ systems, including your heart, your kidneys, your ability to clot blood, your liver functions. It is a sneaky virus that tends to affect more body systems than we ever realize. And that's why we continue to add symptoms that we never thought were involved with the virus, but in fact truly are.
Dr. Dave, thank you for all of that helpful information. We're going to see you back here next week as we answer more coronavirus questions. And to read Dr. Dave's latest blog, just visit our website, cbsdenver.com.